syringe driver. So a syringe driver or a syringe pump is probably my favorite piece of equipment in clinic, and I feel like they're so underutilized, and especially coming into tick season, it just makes your life so much easier. It makes the protocol and the treatment so much smoother. Instead of kind of hand syringing Tick-Anti Serum to patients, use a syringe driver. It is a lifesaver. I'm going to show you how to set one up because sometimes they can be a bit tricky. This one is super straightforward, so let's give it a go. First of all, I've got my Tick-Anti Serum all prepped. I've got my my extension set all primed and ready to go. I would attach this end to the patient, just to their IV or just to their T-port that they've got attached, these little ones. This has all been primed. I've got no air bubbles in here, so this is ready to be inserted into the syringe driver. So it's pretty straightforward. Just being careful with these because this extender arm does come out a long way. So if you were to drop it, it's quite delicate. So just making sure that if you're not using it, making sure that this piece is put back into its kind of initial state. So to open this up and to extend it, so this is where the syringe plunger is going to go. So it's going to be inserted this direction. So I want to open this up and send it that way. So I'm just squeezing this together, these two buttons, and you can see in here those little claws open up. So that's going to grip around the edge of your plunger. So squeeze and it's super smooth, and that just sits like that. This section here, you're going to lift it out this way and turn it, and that is going to hold the barrel of your syringe. Another important thing, and I've seen this a lot, this section gets missed and they go, why isn't it working? It's not sitting, the syringe doesn't fit. It's because these little wings, or I don't know what you would call them, the little handles on the syringe, it needs to be inserted into this little crack down in here. So this section here I'm pulling out and turn. So out and turn to the side. It's easiest if you do it when it's on a bench. If you're doing it up into the air, it's a little bit fiddly. So make sure it's on a nice flat surface. So this is all open now. I want to insert my syringe with my extension set. So I'm just going to insert the little wings into that crack. You might be able to see a little bit closer there. And this will fit like up to a 50ml syringe. I've only got a 10ml syringe. You're probably going to use a 20ml most commonly, but a 10ml is okay. If you're doing like IV antibiotics, you can still use a syringe driver as well. Now once that's sat in there like that, I want to release this, and it's going to hold down onto the barrel of the syringe. So pulling it out and push to the side, and it's just holding it in there nicely so it's not going to fall out. And now to make sure that that plunger is plunging and actually driving to the patient, this section, these little claws just need to be clamped around the end of your syringe. So squeeze these together, push down nice and gently, just until it touches that little sensor in there, like that, and clamp, and it's going to clamp onto your syringe. Now that is in place. You can attach this onto your cage, you can attach this in your surgery. They actually are stackable, so say if you've got a bunch of them, you can stack them up on top of each other. Now that's clamped in there, it's sitting in there really nicely, it's not going to fall out at all. I would turn it on and I would insert the rate that I want to run it at. So say we're doing, I've got about 9 or 10 mils in there. I want to do that 10 mils over 30 minutes. So I would do 20 mils over an hour. So turn it on. I'm going down here. I don't want to recall the last treatment, but it's good that it saves it just in case you had to stop for some reason. So I'm going to press no, recall last treatment. So volume, reset turbo. Yes. So it's told me up here that I've got a 10 ml syringe inserted. So now I'm going to go rate. I'm going to go 20 mils per hour, so that would do 10 mils over half an hour. Volume to be infused, I'm going to do 10 mils because it's 10 mil syringe. Got that. Volume, that. So volume down here, so volume to be infused, so VTBI, that's what I want it to be infused. Volume down here you don't need to adjust. What it's going to do there is going to tell you how much has been administered. So you can keep checking back that to make sure that it is being administered properly. So the rate's at 20 mils. And so I'm just going to press start on here. So it's got a 30-minute time on here because it's calculated that I've only got 10 mils, I don't have 20 mils. And I'm going to press start. Start infusion. Yes. So it tells you all the information on here as well, and I'll be plotting this down on your monitoring charts at the time that you've started, 5-minute monitoring intervals. Make sure if it is a tick, you are doing TPRs, temperature, SpO2, heart rate. You are staying with that patient whilst this is being administered. If you have any kind of adverse reactions, heightened heart rate, respiratory rate is labelled, or respiratory rate is not looking good. Their colour, if it's not bright, nice pink, you need to alert the vet. You need to stop your infusion. So it's telling me time left is 29 minutes, volume to be infused, that is slowly going down, and it's telling me here volume that has been administered there, which I love. So it tells you all the information, but you don't even really have to calculate anything. Easy. A couple of other components of looking after your tick paralysis patients would be making sure you're doing a full tick clip, giving adequate sedation that's needed, just to reduce the risk of there being a second paralysis tick that you might not find. They come and they're so tiny. If you aren't doing a full clip on a long haired dog, you might be treating for one, but there's another one stuck to the patient, so it's an uphill battle for you with that one. Another component would be keeping them on fluids as well after they've had their TAS. This has kind of been indicative that it shortens their time in hospital, especially if they're nil per Oz at the time as well. So making sure they're getting fluids, they're getting some nutrients into their body whilst they're recovering. Another big one is patient positioning when it comes to paralysis patients. If they are getting quite stiff, or they're in their bedding in their cage for too long, they might develop pressure sores. So including something like a support pad where you can actually kind of mold it around their body to keep them in the position that you want, especially if they are at risk of aspiration. You want to keep them in kind of a sternal recumbency. Essential when you are doing your TAS treatment that you are checking not only heart rate, temperature, but you are checking the SpO2. Really important, and visually checking the mucous membranes. So a little handheld SpO2 around with maybe keep them together with your syringe driver, just so if you do have multiple tick patients come in, that you are ready and you do have enough equipment ready for those patients. I feel like tick paralysis is getting worse every year, especially where we are in Southeast Queensland. I feel like they're getting more aggressive each year, and they kind of start earlier on. Like they're starting now and we're only in September. So I think that we're in for a bad tick season. So it's a bit scary, but I think if we get ready now, we might be able to save a lot more pets. Whilst I've been talking now as well, this has kept infusing. So here it's got volume infused, 2.8, time left, 21 minutes. I love that it gives you all of these kind of stats right there on front of the screen. This gives you like a rough idea of how I would have my tick paralysis patients set up. Super comfy bedding. I've got a nice big support pad in there for Daphne, nice and comfortable in her. She's not moving around at all. Will just reduce the risk of pressure sores. I've got my SpO2 handheld monitor here, and then I've got my syringe driver right here. This you can usually attach to the cage doors as well. I just don't have that bracket with me, but I would have this right next to my patient. I would be in here in the kennel with that patient, just so I'm hands-on. If it is a tick paralysis patient, I personally as a nurse would not be shutting the door whilst they're getting their Tick-Anti Serum administered. I believe you should always be with that patient for that whole amount of time, closely monitoring interval, like 5-minute intervals, recording all of your data every single 5 minutes. Even afterwards, after you've administered the Tick-Anti Serum, they need to be so closely monitored for a lengthy amount of time, especially depending on how affected they've been by the tick. Up to your vet as well, they might decide to continue on with IV fluids afterwards, but that is up to the vet's discretion. As you can see on here, we're still going with that amount being infused. So we've administered 8 mils so far, and it's got another 4 minutes to go.